Hello and welcome, ladies and gentlemen, to the Living Healthy, Living Well program. In today's program, we will explore two main topics. 3 minutes every evening rubbing this spot can end your back pain. Seniors with arthritis must absolutely avoid these foods. Now, let's move on to the first topic. 3 minutes every evening rubbing this spot can end your back pain. Do you often wake up in the morning feeling low back ache? With stiff knees, or general joint pain? This is a very common situation. Especially as we age, these chronic, nagging pains can sometimes make it difficult for you to walk or perform daily tasks. But did you know? By spending just 3 to 5 minutes every evening massaging a few special points on your body, you can completely relieve these pains in a truly astonishing way. In this video, the doctor will guide you specifically through these massage secrets. By simply rubbing for 3 to 5 minutes every evening at a few special positions on the body, your back pain and knee soreness will gradually disappear as if they never existed. All of these instructions are based on a combination of modern scientific perspectives and traditional Eastern medicine, so you can perform them with confidence. First, let's explore why massage is so effective. According to modern medicine, when you massage a painful area, the body enhances blood circulation to those regions, delivering more oxygen and nutrients. Simultaneously, it helps eliminate inflammatory substances, effectively reducing pain. Additionally, massage helps relax the muscles, stimulating the brain to release endorphins, a hormone that reduces pain and promotes relaxation. This explains why you often feel more comfortable and sleep better after a massage session. According to traditional Eastern medicine, Dong Wai, the human body operates based on a system of meridians, Jing Mai, and acupuncture points. Proper massage techniques help to clear the meridians, regulate qi and blood flow, and nourish the kidneys and strengthen the tendons and bones. When qi and blood flow freely, pain caused by blockages naturally dissipates. Specifically, massaging the Yongquan point on the sole of the foot, the Weizhong point behind the knee, and the front thigh muscle area will help you effectively reduce back and knee pain. After understanding the mechanisms and scientific evidence, you are likely eager to learn the specific positions to massage and the correct way to perform the steps for the best results. Right now, the doctor will guide you through detailed steps for the correct massage technique, along with small, helpful tips so you can watch and practice right at home. 1. Position 1. Massaging the front thigh area. This area helps relax muscles, reducing both knee and back pain. So why is massaging the front thigh so effective? This region contains a large muscle group called the quadriceps femoris, which connects from the hip down to the kneecap. When this muscle is strong and flexible, it provides good support for the knee joint, helping you walk easily and with less pain. However, due to age or sitting habits, the front thigh muscle often becomes tight and shortened. When this happens, it pulls the kneecap upward, causing misalignment, increasing pressure on the knee joint, and resulting in pain. Not only that, a tight quad muscle also pulls the pelvis forward, causing the lower back area to arch. This is a common cause of low back ache. Therefore, massaging the front thigh muscle helps soften the muscle, reducing knee pain directly and back pain indirectly. From the traditional Eastern medicine perspective, the front of the thigh is traversed by two important meridians, the stomach meridian and the spleen meridian. Massaging this area strengthens the spleen and benefits the stomach, helping eliminate accumulated waste substances in the knee joint. Specifically, about 1 hand span above the knee is the Shuihei point, an important point on the spleen meridian that helps nourish blood, improve circulation, and strengthen the tendons and muscles around the knee joint. Thus, Dong Wai often performs pressing and rubbing techniques on the front thigh area to assist in treating knee pain, degeneration, or muscle atrophy. Here are the specific instructions. Preparation posture. You can sit comfortably on a chair or the edge of the bed, with your legs bent at a 90-degree angle to your thighs. Completely relaxed. Action 1. Warm-up rub. Use the palm of your hand to quickly and evenly rub the front thigh area. Then rub along the center of the thigh. Perform this continuously for 30 seconds to 1 minute to warm up and relax the muscle. When done correctly, You will feel the thigh area gradually warm up, indicating better blood circulation. Action 2. Pinch and press the muscle. After warming up, gently pinch the front thigh muscle with your palm, moving from top to bottom, and from inside to outside. Pinch both sides evenly for 1 to 2 minutes to soften and relax the muscle. If you encounter a painful or stiff spot, you can use your fingers or the edge of your palm to gently press for 10 to 15 seconds. The most common painful spot is about 1 hand span above the knee, which is the Shuihei point. Gently press this spot 2 to 5 times, then switch to the other leg. Action 3. Stroke and stretch the thigh muscle. Place both palms to encompass the front thigh, gently stroking from the center of the thigh down to the knee. Stretching the entire muscle. Perform 15 to 20 times, according to your comfort level. This action helps stretch the entire thigh muscle, making the muscle fibers soft and completely relaxed. You should perform this on both sides alternately for the best results. 2. Position 2. Massaging the sole of the foot. Massaging the sole of the foot, specifically stimulating the Yongquan point, effectively reduces both back pain and joint pain. So why does massaging the sole of the foot help reduce back and joint pain? Did you know, the foot is considered the second heart of the body? It is a concentration point for many important nerves and blood vessels, directly related to internal organs and the spine. In the center of the sole of the foot is an extremely special acupuncture point, the Yongquan point. This point is located in the depression that appears when you curl your toes, about 1/3 of the way from the top of the foot. In traditional Eastern medicine, the Yongquan point belongs to the kidney meridian, where the kidney qi ascends. Since the kidney in Dong Wai is considered the root of bones and joints, healthy kidneys mean strong tendons and bones. Therefore, rubbing the Yongquan point helps nourish the kidneys, strengthen the tendons and bones, and reduce back and joint pain caused by kidney weakness. The ancients often taught, for backache and knee soreness, first nourish the kidney. Massaging the sole of the foot is a simple, effective way to strengthen kidney qi every day. From the modern medicine perspective, the sole of the foot contains countless nerve endings. When we massage, we stimulate these nerve endings, creating a reflex reaction to the brain and spinal cord, helping to reduce pain signals from the back and joint areas. At the same time, massage helps blood circulate more easily, reducing vascular blockages, which is very beneficial for seniors, people with diabetes, or those with numbness in hands and feet. Many studies have shown that foot massage significantly reduces pain for people after knee replacement surgery, and also improves sleep quality and reduces anxiety. Next, the doctor will guide you through the detailed execution. Preparation posture. You can sit comfortably, crossing one leg over the other thigh for easy manipulation, or sit on a low chair, propping your foot up a bit for convenient massage. How to locate the Yongquan point. Gently curl your toes. The point is located between the second and third toes. Once located, we begin the massage steps. Action 1. Press and rub the Yongquan point. Use your thumb to gently rub and press on the point, pressing while rotating in a circle. When pressed correctly, you will feel a slight tingling or dull ache radiating around, accompanied by a warming sensation. That is a sign of good qi and blood circulation. Perform for 30 seconds to 1 minute, depending on your tolerance. Action 2. Massage the entire sole of the foot. In addition to pressing the Yongquan point, you should massage the entire foot to enhance effectiveness. Use 2 hands to hold the foot, pressing from the heel towards the toes. If there are any soft yet painful spots, focus on rubbing those areas more thoroughly. Then, clench your hand into a fist and gently tap the sole of the foot a few times to stimulate blood circulation. Perform for 1 to 2 minutes on each side. Action 3. Toe pull and ankle rotation. Each toe is related to internal organs. Hold each toe, gently pull and rotate it a few times. Then stroke gently. You might hear a small popping sound. That is a sign the joint is being relaxed. Next, rotate the ankle in a circle 5 to 10 times in each direction to make the joint more flexible. Do the same for the other leg, spending about 3 minutes per foot. After finishing, you will feel your feet warm and comfortable. with a relaxing sensation spreading throughout the body. Many people have shared that just a few minutes of pressing the Yongquan point every evening helps them significantly reduce pain, sleep soundly, and feel better rested. This is a simple yet extremely effective healthcare method, especially suitable for seniors. If combined with warm foot soaks every evening, the effect will increase significantly. 3. Position 3. Massaging the area behind the knee. Massaging this area helps activate the Weizhong point, which is very effective in reducing back and leg pain. Behind the knee is the Weizhong point, an extremely important acupuncture point belonging to the bladder meridian. Since ancient times, Dong Wai has considered this point a secret to extremely effective back pain relief. And our ancestors often taught, for back pain, find and press the Weizhong point. The reason this point helps relieve back pain so well is because the bladder meridian runs along both sides of the spine all the way down to the foot. The Weizhong point is the convergence point of energy for the back and leg area. When pressed correctly, qi and blood are cleared. The muscles in the lower back area relax their spasm, and the back becomes looser and easier to move. Furthermore, the Weizhong point is located in the leg area, where many important tendons and muscles connect from the thigh down to the calf. Massaging here allows the tendons and muscles to relax and become more pliable. As a result, the knee joint's pressure is reduced, and pain is distinctly lessened. From the Western medicine perspective, the area behind the knee is also where many tibial nerves and arteries are concentrated. Gentle massage here helps stimulate the nerves, relaxing pains that radiate down the leg, such as sciatica. In addition, massaging the popliteal fossa, knee pit, helps blood from the legs circulate back to the heart more easily, reducing blood stasis, which is especially beneficial for those with numbness in their limbs or poor circulation. Many therapists also recommend stretching the hamstring muscles, because when this muscle is flexible, the back and knee muscles are also more pliable and less painful. Therefore, massaging the area behind the knee contributes to softening tendons and muscles, benefiting the knee joints, hip joints, and spine. Regarding the preparation posture, you can sit comfortably on a chair, with your legs relaxed and knees bent at a 90-degree angle. If you want more relaxation, you can lie on your back on the bed, slightly bending your knee for easier execution. The Weizhong point is located exactly in the center of the crease behind the knee. Once the position is located, we begin massaging this area. Action 1. Press and rub the Weizhong point. Use your index and middle fingers to gently rub and press the point 15 to 20 times in a circle, gradually increasing the force according to your tolerance. When pressed correctly, you will feel a slight tingling sensation radiating down the calf, accompanied by a warm, comfortable feeling. Perform for about 30 seconds to 1 minute on each leg. Action 2. Gently pinch the soft tissue area behind the knee. Use your fingers to gently grasp this area, pinching softly and moving from inside to outside for 30 seconds on each leg. This action helps the tendons and muscles relax and soften, while also stimulating better blood circulation. Action 3. Stroke and stretch the muscle. Place 4 fingers into the popliteal fossa behind the knee, with your thumb placed on the kneecap. Stroke downwards 15 to 20 times, imagining you are pushing out all the tension and pain. Then, fully straighten your leg, hold for 5 seconds, and then bend your knee back. Repeat several times to stretch the tendons and muscles, effectively reducing pain. When finished, slowly stand up, gently bend forward to stretch the knee muscles, helping the body feel comfortable and relieved. Thus, the doctor has guided you through massaging 3 important positions that help reduce musculoskeletal pain, especially in the back, in a simple yet effective way. If you feel less pain, please leave a comment to share your experience so others may know. Next segment. Next, let's move on to seniors with arthritis must absolutely avoid these foods. Dear viewers, as we enter middle age and senior years, musculoskeletal pain is almost unavoidable. Besides the natural cause of aging, diet also greatly affects the health of the musculoskeletal system. Many studies show that some foods can reduce inflammation, while other food groups can activate the inflammatory response, worsening the condition. In reality, there are hundreds of different types of musculoskeletal diseases, but they all share the commonality of joint inflammation. However, the causes of inflammation are very diverse. For example, conditions like rheumatoid arthritis, ankylosing spondylitis, or reactive arthritis all belong to the group of autoimmune diseases, while gout stems from a metabolic disorder of uric acid. Furthermore, osteoarthritis and osteoporosis, two other common diseases, also seriously affect the joints, but their mechanisms and causes are completely different. Whether it is acute or chronic arthritis, the final consequence is the destruction of joints, leading to reduced mobility. When mobility is lost, patients have to depend on others, becoming a burden on family and society. What most of you are most concerned about when suffering from arthritis, especially chronic pain, is how to eat so as not to worsen the condition. So, what should you eat and what should you avoid to prevent recurrence? Let's find out with the doctor right now. 1. Sugar and sugar-containing foods. The first type that many people might not expect is sugar and sugar-containing foods. Throughout the process of examining and treating patients, the doctor notes that very few patients know that people with arthritis need to cut back on sugar. When advised, many seniors are surprised and ask, "Why'd I have to avoid sugar?" In fact, sugar is one of the main culprits that cause inflammation in the body. When consumed excessively, the body produces cytokines, substances that stimulate the inflammatory response in the joints. Not only that, sugar increases insulin levels in the blood, leading to the formation of advanced glycation end products, AGEs, factors that damage soft tissue cells and joints. Foods high in sugar like processed sweets, syrups, soft drinks, and carbonated beverages all make the arthritis condition more severe. The doctor's advice: reduce refined sugar and use natural substitutes like molasses, maple syrup. Limit soft drinks and carbonated beverages, replacing them with water, herbal tea, or fresh fruit juice without added sugar. If you like sweets, you can bake them at home, which ensures safety while allowing you to control the amount of sugar consumed. 2. Foods rich in omega-6. Although omega-6 is an essential fatty acid for the body, consuming too much causes an imbalance in the ratio of omega-6 to omega-3. When this ratio skews towards omega-6, the inflammatory response in the body increases, exacerbating arthritis symptoms. Vegetable oils such as sunflower oil, soybean oil, and corn oil contain very high levels of omega-6. Although they are often used in daily cooking, using too much can stimulate inflammation in the joints. Therefore, you should balance vegetable oils and animal fats, and also generally limit oil and fat in your diet. Furthermore, some nuts that seem healthy, like sunflower seeds and pumpkin seeds, also have high omega-6 content. Although nutritious, if eaten in large quantities without combining with omega-3 rich foods, the body will experience an imbalance of fatty acids, making the arthritis condition more severe. To protect your joints in your daily diet, you should increase foods rich in omega-3 such as salmon, sardines, chia seeds, and flax seeds. Additionally, olive oil is a very good choice to replace common vegetable oils because it helps fight inflammation and protects the heart. 3. Fried, grilled, and charred foods. To be honest with you, the doctor also finds fried, grilled, and roasted dishes incredibly fragrant and appealing. But if you understand the harm they cause, you might find them less appetizing. During the process of frying or grilling at high temperatures, food produces toxic compounds such as acrylamide and AGEs, advanced glycation end products. These substances increase the inflammatory response in the body. They not only cause joint damage but also affect many other organs. Specifically, grilled or fried red meat can increase the risk of cancer, especially diseases of the digestive tract like stomach or colorectal cancer. Therefore, you should minimize them. Common fried foods like French fries, fried chicken, and fried pastries all contain high saturated fat, which easily stimulates the production of inflammatory substances, causing joints to swell and ache more. Charred grilled meats or foods processed at high temperatures also produce toxins, worsening the arthritis condition. The doctor's advice: instead of deep frying or grilling at high temperatures, you should choose healthier cooking methods such as steaming, boiling, light stir-frying, or roasting at low temperatures. If you want to save time, you can use an air fryer or microwave to reduce fat absorption, which is tasty and still good for your health. 4. Breads, pasta, and gluten-containing foods. A breakfast with a sandwich or a plate of pasta with tomato sauce is certainly delicious, but it is not healthy for people with arthritis. The common characteristic of foods made from wheat flour is that they contain a lot of gluten, a type of protein found in wheat, barley, and some other grains. In people with arthritis, gluten can stimulate the inflammatory response in joint tissues, although gluten is not a direct cause of arthritis. For those with rheumatoid arthritis or who are sensitive to gluten, it can make the inflammation more severe. White bread, pastries, pasta, and processed foods often contain high levels of gluten, causing discomfort and joint swelling, pain if consumed regularly. Therefore, if you have arthritis, prioritize gluten-free foods such as rice, sweet potatoes, corn, or organic products made from brown rice, cornmeal, quinoa, or mung beans, which are both tasty and safe for your joints. 5. Red meat, seafood, and alcohol. Red meat and seafood are favorite dishes for many people, especially men at parties. However, this is a food group that can worsen arthritis due to high levels of purine. Purine is a natural substance found in many foods. When metabolized, the body creates uric acid. In people with gout, a common form of arthritis, high levels of uric acid crystallize into urate crystals in the joints, causing severe swelling, pain, and inflammation. Red meat, seafood, and some legumes like lentils and soybeans all contain high levels of purine. Especially, alcohol, although it does not contain purine, stimulates the body to produce more uric acid, significantly worsening the arthritis condition. Therefore, if you drink alcohol, you should limit red meat and seafood even more. The doctor's advice: reduce the intake of red meat and seafood rich in purine. Replace them with white meat, eggs, or low-fat milk. Drink enough water every day to help the kidneys effectively excrete uric acid. Limit alcohol to protect the liver, kidneys, and joints. As you can see, arthritis not only affects joint health but also strongly impacts the quality of life. Diet plays an extremely important role in controlling the inflammatory condition. Therefore, avoid foods that are harmful to your joints. And at the same time, increase healthy eating to live a healthier, longer life every day. Don't forget to follow the next videos of the Living Healthy, Living Well program to update the most useful health information with the doctor. Thank you for your interest and viewing. Goodbye and see you in the next programs.